Yes, Dr. Tiger sir.
Hello, hello, sir. Good evening, sir.
Very good evening, sir. You are able to see me.
Yeah, sir. Yeah, sir. I can see, sir.
Okay, only I am not able to see you. I think it is
Why?
uh, my internet speed only. Just let me change the internet to the other
But you
SIM
are
card.
visible for me, sir.
Yes,
You
sir.
are visible.
But you are not visible for me. Yeah, hotspot and just a few seconds, sir. Yeah.
Okay.
Let's see. Okay, but still
Okay,
you
sir.
are it for me.
Now
There are many
visible.
of my followers. They are all joining.
Yeah, sir. Lots of people joining.
Always good.
Sir, I am visible for you, sir.
No, sir, not yet. Initially, first you are visible.
Okay.
After I joined, then you are not visible. Yeah, our Ritu Sani ma'am also joined.
Oh, who, sir?
Ma'am
Hindu?
is the president of AYMPT, sir.
Oh, oh, okay, 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 okay.
This ma'am is saying both are visible.
Sir, you are visible for me, sir. What about you, sir?
No, I'm not able to see you, but I can try seeing you from my other Instagram where uh,
Sir, but people said both are visible like that.
yeah, they are telling both are visible. I am only not able to see you. Mhm. In your profile, I am searching where is this live video. Mhm. Yes, and as I am seeing, yeah, both are visible in the other device.
Oh,
Okay, no problem. I can see you in the other device. See,
yeah, sir. Yeah, sir.
both of us are visible. Right? So
Yes, sir.
it's great, sir. Vanakam, good evening. And
Good evening, sir.
the most important topic of the most awaited development in profession of physical therapy is the National Commission of Allied and Healthcare Professions. And the guest, Dr. Diwagar, popularly called as the Tiger Diwagar, the one and only physio who is, as a single man army, daily following it up on the National Commission of Allied and Healthcare Professions. The work that has to be done by an association or even a groups of association is done by a single man. And this physio is from Madurai, heading the Selvarani Physiotherapy Clinic. As a clinician, he also shares all his clinical videos, and as a person, also as a hobby, as an actor, you would see a lot of his clips on his performances on one of the very famous uh, Tamil movie scenes in the past. So he's a great entertainer, he's a great educator, and also a great enterprising leader. So we are pleased to have sir today evening with us, and we wish sir in his endeavors the best of luck in plenty to begin with. Vanakkam sir.
Good evening, sir. Good evening, sir.
Yes sir. And we'll begin with I want to know about what is Diwagar before becoming Dr. Diwagar. So Can you tell about your early years of your life?
Sir, basically I am from Madurai district, sir, Tamil Nadu. I was studied in Madurai St. Mary's Higher Secondary School, one of the leading higher secondary school in Madurai district, sir. So I was studied Madurai St. Mary's Higher Secondary School, sir. Then from my school life also, I am a best outgoing student, sir. Then I am getting good marks. I am scored also good marks, 10th and plus 2s. So that time also I had a curricular as well as extracurricular. Because of I was studied in St. Mary's, sir. That's a totally is a Christianity school, sir. So I got and I developed my extracurricular lives also, like singing competition or drama competition, then speech competitions. So I molded by my schools, Madurai St. Mary's Higher Secondary School. So then now I have become good physiotherapist, everything by my school, St. Mary's Higher Secondary School from Madurai district. Because of I don't know what is physiotherapy, but my zoologists are molded me. It's a good course. You can join and you will get a good future like that. Then only I am knowing about the physiotherapy, sir. So I was studied in good school. Then only I got a good degree. Because of my aim is MBBS. Why I didn't get, because of I am a best outgoing student. But my plus two life I didn't study, sir. Frankly, I am telling. Sixth to 10th, I am getting more marks. First rank, second rank, like that, sir. I am getting more marks. But plus one, plus two, I am didn't do that much level hard work. So I didn't get MBBS. But my zoology sir said me, sir, you are a great person. You are having more knowledge. Don't worry. Physiotherapy also, bachelor of physiotherapy, having more scope. So you can join like that, sir. So then only I joined, sir. Then I was studied in Salem Sanmo College of Physiotherapy, sir. I am 2005 to 2010 page graduate, sir. I joined B.P.T on 2005, Salem Sanmo College of Physiotherapy, sir. From school life, college life also, same thing, sir. Curricular as well as extracurricular. I am doing my best, sir. So lots of professors, college chairman also. College chairman name is P.S. Pannirselvam. He is also attracted by my extracurricular activities and curricular activities and our subject knowledge. He is also attracted by me. So he given more important for me, sir. Because of even college principals also, he is getting appointment. Then only he will see the chairman, medical director. By for me, don't no need. Simply, I am going and visiting a medical chairman, sir. This is my school life and college life, sir.
Yes. And once you became Dr. Diwagar, what were your thoughts that future of physiotherapy, or have you ever imagined that this much you will work for physiotherapy? There will be a lot of inputs people would have given. Physiotherapy you do means you can go abroad, or they would have told that you do MPT. Lot of people suggest lot of suggestions when you are doing physiotherapy. Have you ever thought that at this situation, as a physio leader, you will come in the front?
Sir, actually, I was joined 2005 on my college life. That time, our physiotherapist, lots of people said BPT is a very tough course. So, if you cannot study now, you can join to BS nursing or some other courses like that. But I said, no, sir, I like physiotherapy. I want to become doctor. That's why I selected a physiotherapy professional. So, I don't want another courses. I want to become doctor like that, sir. So, some professors also given sarcastic comment because of BPT is very tough. Anatomy physiology also very tough. So easily we cannot pass like that somebody said. But that time also, actually, sir, within 15 days, when I am joined on my college life, when I joined on BPT first year, within 15 days, our college celebrate a annual day celebration, sir. Sorry, not annual day, sir. Farewell day celebration. In that chief guest, so one of the chief guests came to our college function, sir. He asked if anyone have your aim, come and tell me on stage like that. No one uh, no one said about their aim, but I am going, sir, I am going, and I said about, sir, I want to become physiotherapy doctor like that. Okay, for that what you are doing like that? He is asking, sir, now I am doing first year only, I want to become a physiotherapy doctor. So chairman also attracted, sir, because of our chairman is medical surgeon. P.S. Pannirselvam is the leading surgeon of the Salem city. He is also surprised. Oh, first year student having this type of this kind of enthusiasm like that. So then second year, third year, I am getting more knowledge, sir, because of I was studied our books and I contact with our seniors like that. Then the third year, fourth year, I planned we want to do MPT like that. When I was in internship, that time I planned no need MPT. So for clinical practice enough. Then, sir, my aim is to become a professor with clinician. But, sir, I want to say the true things. By teaching side, we are not getting more salary. And we are wasting our future plans also. That's why I dropped my idea, sir. Then I am concentrated on clinical side, sir. Because of clinical side, we are having more opportunity. By hospital also, they are given low salaries, sir. But when we are developing our skill, when we are came to the private products, then our demands was raised because of lots of VIP patients waiting for us. Not only VIP patients, middle class, poor patients, each and everywhere our service needed. So our time should be important, sir. That's why I stopped my MBT plans, sir. Because of
Okay.
in our UG study, because of in our UG studies having all the syllabus, manipulation, mobilization, PNF, every techniques in UG. So BPT is a big C. Still now we can't learn here BPT, sir. Still now every day I am studying. We are having every technique, sir. Muscle releasing technique, tendon releasing technique, tendon gliding exercise. Every exercise we are studied in BPT. That's why I plan, sir. I don't want to join NPT. Future days we will see. Because of now we are having busy schedule. We want to develop our clinical skills and we want to develop our private products, then only I want to do MPT, sir.
Okay. And as a clinician, you have been treating lots of cases. You are seeing orthopedic, neurological, cardiopulmonary, every type of patients.
Yeah, sir. Sir,
And when did you realize that our profession actually needs some repair work? Like there are some things in the profession where we can improve, or we have to fight for it. Okay, especially what I am trying to tell is, when did Dr. Physio Diwagar became the Tiger Diwagar? Yes, sir.
from from my college life also, I have become a tiger, sir. That time also, I am fighting for our rights. I am shouting for our rights, sir. Because of 2008, I am a third year BPT student. That time, the Salem Periyar University, they are trying to start the diploma physiotherapy courses. So I am making big crowd of Salem city. Each and every colleges, I am creating more awareness. Because of that time, I am a third year student, but I am creating more awareness to internship students, fourth year students, and nearest college. Gokulam College, Vinayak Mission College, Anna Teresa College. I am making big crowd for associations, sir. Then only the Periyar University, they are stopped a diploma physiotherapy courses. So this is big pressure for Periyar University VC. Because of Periyar University VC is close with our college, sir. Then when we are lots of medical college professors, they came and teach to our BPT students, sir. That time also I am shouting and fighting for our rights, sir. Then, sir, the Salem IMA, Indian Medical Association president, he was my rehabilitation professor. So that time also we are fighting. He said, paramedical also good, so don't fight against paramedical like that, he said. But I said, sir, so paramedical is the allied health sciences. We don't want this terminology. We want separate category like Maharashtra. Because of, sir, I got this professional knowledge by my IAP journals and IAP newsletters, sir, Indian Association of Physiotherapy newsletter. I read that. So I got more knowledge, sir. Then our college HOD, Dr. Sandil Kumar, I think, sir, you know about him. He is also IAP member and convener of Salem IAP. That time he is also given some more knowledge, prefix matter and something sir, professional related like that. So we got more knowledge, sir. That time association knowledge also. Then when I was a student, that time Dr. Janardhan, he was a IAP vice president. That time Ali Rani also president. So I am having good contact with our ex-president Dr. Janardhan. I think he was worked college principal in North Side, Bombay or something. So that time also, I am fighting for our rights in ICU setups, colleges, chairman side, college side, from my college life, from my student life, during my internship period, that's also I am fighting for our rights, sir. Because of another medical professionals, when we are enter into the hospitals, clinical settings, nurses, they don't know about who is physiotherapist. They are thinking physiotherapist or technician like that. So I am created more awareness. No, ma'am, we are not doing simple passive movements. From my during my internship period, I explained we are given stretching, strengthening. We are having PNF technique. Even physiotherapists also cannot learn PNF technique. We are doing diagnosis. So physiotherapists are medical professionals. We are also doctors. Like that, I explain to each and everywhere, sir. When I am going to the internship period, where I am going to the another hospitals, everywhere, each and everywhere, I am creating more awareness, sir. Because of during my internship period, I am very enthusiastic, sir. Because of I saw a burns cases. Still now, our people not aware about burns cases, sir. So when I am doing burns cases or wound debridement cases, our peoples are feared and they said don't do this kind of activities, don't handle this kind of patients like that. But I didn't get any fear because of my internship period. My internship session was good. When I entered to the burns unit, that times are without fear because of my professors. SBMM Hospital, Salem. Yes, Palaniadi Mudaliar Memorial Hospital, they are treating every kind of burns patients, sir. When they are stretching, that time the blood also bleeds, sir, but the staff, they didn't get any fear. When we enter to the burns unit, we are also infected, but I am not bothered about that because of heads of my professors, sir. They are also supporting me. That time our another peoples, they are actually, sir, they are not interested, came to burns unit. But without fear, I am entering into the burns unit, sir. Then, because of physiotherapy is the not only ortho, not only neuro, we are handling the every system. That's why we are using prefix DR. So, from my internship period, from my students period, even I can talk, argue with my college chairman also, sir. When during in my internship period, because of sir, another I want to say something. Duty doctor is there, sir. Nurses is there. B.P.T students is there. Our chairman, we are going the chairman round, sir. So chairman is here, general surgeon. He is asking lot of questions. If he asked 30 questions now, I will reply 80 questions, sir, with correct mode. So MBBS doctor, duty doctor is also getting irritated. One day duty doctors came to me, sir. She said, sir, Diwagar, kindly request me, don't ask any question or any doubt to the chairman. Because of you are asking question, then every question repeated to me. I can't answer. So that time also I am very enthusiastic, sir.
Okay,
Because of
okay.
sir, actually my professors knows my life. Professor Dandamani, Sendil Kumar, Murugan, S.K. Rajkumar, lot of, I think all are your friends. Then Sendil Kumar, he was worked in Salem, St. John's College, sir. He was worked as the principal. Lots of people knows about me, sir. Even nursing colleges people also appreciate me, sir.
I think you got a phone call, sir. Your
No,
voice is
no,
not
no.
coming.
Okay, sir.
Between just recently now, last 1 minute.
Yeah, sir. Yeah, sir. Actually, I can't. I am not attend that. Why this time the phone?
Yes, yes. So now again, I think you got a call. The voice is again cutting.
Sir. Now can you hear?
Now,
Now?
now you are audible,
Okay.
but last two
Okay.
sentences we couldn't hear.
Oh, now, sir. Now, okay.
Now it is okay. Now it is okay.
Okay. Okay, sir. Okay, sir.
Now again, I think it is ringing.
No, sir. No, sir. Nothing.
Your voice
Nothing,
got
sir.
again in between.
No, sir. I didn't receive any phone call, sir. Now, can you hear me, sir?
Yes, sir. Sir, audible.
Okay. Okay.
Yes, sir.
Tell
So,
me, sir.
so the tiger and of course the initial activities, every level, not only at the college but also at a public level, how it got shifted to the association level. Like for example, did you attend our conferences, our national associations? Did you would have met a lot of other seniors, and how that larger transformation, that means from regional to a national figure, a public figure, how did you become?
Sir, everything by God, sir. I didn't plan anything. Actually, sir, from my college life, school life, my professors, even my classmates, all are sarcastic. They are given sarcastic comments, sir. You are having to become national president of IAB like that. So, okay, that time it just is a sarcastic comment. Then, sir, when 2010, I have completed my B.P.T course. Then I am very strong in, I am focused on my clinical practice. I didn't do any kind of association activities because only I am reading IAP newsletter, sir. Because of as the junior, we didn't get any time, sir. We want to marketing, we want to catch the patients, we want to so. I am having severe commitment. Even, sir, in Madurai district local association, they are also making lots of meetings. But in that meeting I could not attend, sir, because of the meetings was totally waste. They are speaking, they are wasting our time. So from 2010 to 2018, I didn't join any kind of activity, sir. I am doing my projects. I saw variety type of patients, even money also, good earnings. I am a leading the professional like that, sir. Actually, sir, 2018 only I purchased this kind of mobile, 4G mobile, sir. That time also Corona COVID time like that, sir. So somewhat treatment videos, some kind of treatment videos I uploaded on the social media. That is viral. Even the wound debridement cases, sir, that video was viral. I am putting lots of, so lots of people appreciate me, especially in the North Indian physios. So again, I am getting interest. Oh, people are watching our videos. Again, I upload that, sir. So again, people are watching. I am getting more views. Then lots of people calling me, encourage me like that, sir. Then, sir, then I am doing the next level step. When I am putting wound bed sore patients, sir, I am given a soft tissue manipulation around the gluteal muscles, sir. So lots of people getting angry and somebody scolded me like that. So I explained, it's not a bad, it's not a bad. Gluteal massage, from my second year, we are learned massage is our technique. Massage is the very effective technique. Why we are studying this kind of techniques? When we attend the patients, that time we will apply our theoretical knowledge. So everything I explain, sir. Then people accept. Now I am putting bedsore videos, especially the gluteal muscle. Lots of people appreciate me. So Tamil Nadu people only somebody is creating for problem for me. Why you are putting this kind of videos, sir? Actually, when the patient, our eyes, we are handled as a patients only because of we are all mother for patients. Apart from money, apart from patients, so apart from that, we are mother and we are God for the patients. So without any, we want to serve them, sir. So step by step, I am become famous, sir. Then basically, I am a good speaker. Always in my school life, I am getting first prize of speech competitions, sir. Even college life also. So sometimes I am putting even, sir, lots of the time our even college Germans also said you become a minister also. You at that level you are having political. I don't know, sir. I don't know, but sir, I want to put good sweets for his mouth. Because of when came to my father and grandfather, we met the college chairman. That time he said he become very strong physiotherapist. He become very famous physiotherapist. He earned 2 lakh, 3 lakh per month like that, sir. He's appreciated me. That time I can't understood, but when I am doing the clinical projects, when I earned more money, that only I realized my power. So, sir, I am putting the treatment videos, speech videos. Again, started because of college life also. The Republic Day and Independence Day, I am doing lot of professional activities. So, say sorry, sir, not extracurricular activities, speech, moon acting. So, I got a lot of fans also, sir. So, again, I am putting treatment videos, then the speech videos regarding professional councils. So, again, I am getting more views. I got phone call from variety states, variety districts from Tamil Nadu. So then, sir, I am very interested to join your social medias. Then basically, actually, sir, when I completed BPT degree, that time I felt every day I am very sad, sir, because of our extracurricular activities, everything finished on our college life. School life we are doing, college life we are doing. Now we are the clinical practitioner. our talent, everything, it was finished like that. I am thinking, sir. But my aim is I want to become actor also. Because of I'm doing any kind of acting, sir. I do because of from my school life also, sir. Every time I received first prize. Because of sir, acting is a good person, sir. If I am on cine field, then sir, not only acting, I am a enthusiastic, sir. Hard work. Actually, never break up my aim. Continuous effort, sir. Without any breakup, I am doing continuous effort. That, because of if I am on cine field, definitely I am become like Sivakarthi, Nana, and Dhanush, like that. Even Dhanush also fear about in front of camera. I didn't get any fear any cameras or any kind of camera. Because of Cinefield also missing me, sir. Then Cinefield also never seen me type of actor. I didn't get any stage fear, sir. Not a stage fear, anything. If you are putting any camera, I didn't get any stage fear. I didn't bother about anybody because of from my school life also. I am a become actor. I am doing lots of stage performance. So lots of people appreciate me. Some people are sarcastic me. Even Rajinikanth also people are telling somebody is Rajini is a mental, but he is in big stage. They are blaming actor Dhanusan also, sir. When he was in first movie, Tulluda Ilame, that time I was studied in 9th standard. That time Dhanusan also getting lots of sarcastic comments. But now he is become a leading actor, like that, sir. So that's why, then, sir, when I am seeing social media, that time just I uploaded my reels. My reels also become very famous. Then I am doing little bit acting videos, reels videos, songs videos. So it will cover the lot of people, sir. Actually, sir, I want to say the truth. People are watching more video. They are watching more videos, sir. Everything is reels videos. They are watching more. Actually, we are uploading treatment video also, but people's watching reels only, sir. Most people watching reels, actings like that. Because of that, people's mindset only. People's mindset, sir. I am also. If anything is attractive or good acting, if anything different from normal, then only we are watching that. Otherwise, already we are studying, sir. We knows everything. Even my teaching video also, sir. It is very simple, easy to understand. Performance, way of presentation. It is easy to understand. It will cover the lot of students, sir. Even my lot of students said, sir, we didn't get this kind of knowledge from my school life, college professors. We didn't get, sir. If you are telling rude approach, we don't know. We are studying cryotherapy, but we don't know how to apply the stroke patients. Which icing, quick icing, slow icing is there. Which kind of icing we can, everything we learn from you, sir. So continue your videos. Even bedsore also, gluteal manipulation, it is very different to all states, sir. It will blast on all states. Lots of people say to give IFT, ultrasound, IRR, like that. But gluteal manipulation is better than IFT, IRR, like that. So when I am doing, lots of people learn and they are doing, sir. So day by day, it reached on national level, sir.
I think again phone call came.
No, sir, nothing, sir.
Okay. And what I am curious is, did you get any chances in the Kollywood, Tollywood, or the Bollywood for
It's
acting?
not easy, sir. It's not easy, sir. It's not easy, sir. But one day I have become any Hollywood or Tamil. One day become my actor, sir. Because of I am having continuous effort. Definitely, I become actor, sir. One day you will see on Tamil movie or anything. I am having a confidence. Sir, again I want
That
to say,
means
if I am planned,
if
definitely.
you get acting chance, then you leave physiotherapy.
No. Always I am a doctor, sir. When I am going to the shopping mall, I am putting prefix doctor, prefix DR. When I am going to the each and everywhere, I am putting prefix doctor. Proud to be a physiotherapy doctor, sir. If I am on movie, sir, if I am become actor, na, our profession it will reach on more better than this. Because of when I have become social popularity, now I am a normal Diwagar. If I am an actor, if I am known by each and everybody, na, our profession it will reach to each and everywhere. Then agitations. If actor Vishal doing hunger strike for physiotherapy profession, na, it will reach more. Even Chief Minister also watching, Health Minister also watching. watching, and each and everyone's watching, sir. So I want to become actor. That time also I am a physiotherapist. But sir, lots of people, best example, our physiotherapist, lots of people become a government officers. They are forget our profession. They are not using prefix DR. Latest days, I went to one bank. Our physiotherapist, she is in big position. She never used the prefix DR. But another one person, he is from veterinary. He is using prefix DR. So they are forgetting our profession. But I never. Basically, I am a physiotherapist, sir. So each and everywhere, I want proud to be a physiotherapy doctor. I want to say physiotherapist and physiotherapy doctor, sir.
And any thoughts in between or any offers what you got for contesting in the elections,
Yeah,
the general
any
election?
offer.
Yes, sir.
Election means our IAP, our
Not
association election.
the MLA, MP.
Sir, but I am getting good influence in political side, sir. Even lot of ministers, MLAs, all are watching my activities and my speaking, everything they are like. But I am not in that level, sir, because of we are not having time. We are mostly I am on clinical practice, sir. We didn't get time, sir. But
Because
sometimes I am going about.
if you become the health minister, definitely directly you can implement the
Yeah, sir.
through
If I have become a health
the
minister,
documentation, everything.
yes, sir. But it's not easy, sir. It will take some time, sir.
Okay. So apart from the actor or the politician, the physical therapist, tiger, also clinically is seen as Brahma and Vishnu. So tell us about that Brahma and the Vishnu.
Yes, sir, actually, sir, one stroke patient only, he is only telling you are a Brahma because of he is a chronic case. I treated him on first 4 years, sir. So that time he said, sir, you are made me. Our muscle power, everything was gone. So from that time also, now we are working everything by your efforts only. Because of neurologist in hospitalization, just 8 days only. After that, every moment, everything by you only. So you are all Brahma, Lord of Brahma. He was a school headmaster, sir. So then only always I am using we are Lord of Brahma. Yes, sir. Then only I am thinking, oh yeah, we are made another life. We are making another life for your stroke patients. Then only they are working. So that's why I say the Lord of Brahma. So then Lord of Vishnu means yeah, Lord of Vishnu duty is the protection of the people, sir. But we are given
No, I saw that Brahma you have put for the neurophysiotherapy and Vishnu you have
uh,
put for the cardiopulmonary.
yeah, sir. Not sir, DVT, deep vein thrombosis
No, I
patients. Because of sir, we are
also
preventing
you
a
are doing
common.
clapping and the ICU patient you have put Vishnu.
Yeah, sir. Because of we are protecting patients now. If we are not doing the chest physiotherapy, automatically patients are getting more secretions. Then the saturation was reduced. Then doctor also ICU doctors also cannot do anything, sir. Automatically patient was sick and it goes to the cardiac arrest, sir. When we are doing proper chest band place, not only chest band placement, sir, we are putting suction. So we are handling tracheostomy tubes also. So we are putting suction when patients are ventilator. When patient on ventilator, that time also we are teaching a breathing exercise. Then weaning off from ventilator is a main duty of physiotherapist. Because of when patients are in ventilator, we are handling a ventilator also, sir. Actually, sir, when the patients on high level positive area pressure, when we are become we improve the patient lungs, then we will change the pipe up mode to CPAP mode. CPAP is a continuous positive airway pressure. So then we are given some training, then only waning of the patients. So our role is main. We are also protect the patient's life, sir, in ICUs. That's why I am telling a lot of.
I thought there is some hidden relationship. Neuro means Brahma, cardiopulmonary means Vishnu, Ortho means Lord Shiva.
Anyway, physiotherapy profession totally is a god, sir. It's not a simple matter because of another doctors. They are simply coming, watching, going. Physiotherapy is not here. We are assessing, we are diagnosing, and we are doing a treatment. We are putting hard work. We are putting mental work. So we are doing lots of work for patients' recovery, sir. So totally physiotherapy. physiotherapy is the equal profession of the God, sir.
Yes, sir. Now we come to the NCHP or the
Okay, sir.
Physiotherapy Council. Okay, when
Okay.
was the first step? Can you tell chronologically how that work for council, when you started, and what went on initially for the Physiotherapy Council at Tamil Nadu level, and later going to the national level, every state councils when they were forming, and afterwards the NCHP came into the act came, and then now NCHP again the state branches. So can you take us in your journey initially the Physiotherapy Council and that efforts for that? Yes, sir.
So actually, from my college life also, I am getting knowledge about council. Council means it's a bar council, our legal recognition. So that time also I am knowing about council importance. Then I read a IAP newsletter, sir. That time, actually, sir, 2008, 2006, that time our Indian Association of Physiotherapy, they are fighting for council. They are asking separate independent PCI, Physiotherapy Council of India. But that time, actually, sir, the IMA, Indian Medical Association, strongly opposed to our council bill. Then the lot of doctors, they are in health ministers, they are having more influence in political side. So that's why they are opposed to our bill, sir. So the central council bill always bending. When they are putting Lok Sabha, that will be rejected. Because of their state paramedical, they are putting wrong definition, sir. Physiotherapy is the medically directed profession. So they are putting wrong definition. That's why IAP, they are not doing a forward step, sir. Because of IAP said, physiotherapy is the system of medicine. It is examination as well as treatment. IAP have a standard definition. They are not accepting IAP definition, sir. Then, sir, in the 2000 period, Maharashtra Council, then the Gujarat Council, every council was constituted, but they are very safe. They are in very safer side. Even Gujarat Council putting prefix DR, Maharashtra Council putting prefix DR, and they are having physiotherapy is the branch of medical science. Gujarat, actually, the Maharashtra Council had physiotherapy is the branch of medical science. Delhi Council of Physiotherapy had physiotherapy is the modern system of medicine, like that. So each and every state council is having a good definition, but they are save only their state physiotherapist only, sir. In our Tamil Nadu 2008, one orthopedic surgeon, sir, he is having more political influence. Purposefully, he is also putting physiotherapist or medical director professional. 2008. So lots of problems on Tamil Nadu. So, but physiotherapist councils, physiotherapy association, they are not accepted that council, problematic council. So each and every states are having these kind of problems, sir. So then our IAP again they are fighting for our council. When the Umashankar Monty was IAP president, then Ali Rani, that times are again they are submitted to parliamentary committee. But parliamentary committee also initially they are not accepted. But sir, our IAP, they are mentioned here WHO, World Health Organization. As per WHO, physiotherapists are healthcare professional. So our IAP, they are making clear documents about WHO. Then sir, ISCO code, World Health Organization, ISCO, International Standard Classification of Occupational. Of that occupational code is 2264. Physiotherapy is the healthcare professional and a separate autonomous profession. Physiotherapist are first-hand practitioner. First-hand practitioner, it described physiotherapist are independent practitioner. So everything our IAP they are submitted to the central government, then they are accepted, sir. Standing committee was accepted. Physiotherapist are healthcare professional. Because of then, sir, we are asking separate PCI, Physiotherapy Council of India. Then, sir, our Modi, he was selected as Prime Minister. He elected as, sorry, not selected, he elected as Prime Minister. That time, he basically like physiotherapy, naturopathy, yoga. So, Prime Minister Narendra Modi ji, actually, sir, our Physiotherapy Council bill bending on last 10 years. That is not possible in Lok Sabha, Rajya Sabha. But our side representation, lots of people working for Ali Rani, Dr. Ali Rani, Dr. Umashankar Moti, Prabhat Ranjan, and Sanjay Kumar. Lots of people. Sanjay Kumar is also working for that. Lots of people working. But when the Prime Minister Narendra Modi ji, when he was in Prime Minister, he is in Prime Minister, then only it will approve, sir. Then this council framed by WHO, International Standard Basics only they are framed, sir. Then they are given same code, WHO code, they are given to our NCHP Act also, sir. They are given our professional code is 2264. Lots of people shouting, sir, NCHP Act is against of us. Lots of Tamil Nadu, lots of physiotherapists against of NCHP Act. They are spreading false information about NCHP Act. So we are asking separate council, sir. But government said, sir, government don't know about me, our professor. They said it will more expenditure. So we cannot do like that. So allied health bill also long time pending. That's also not passed. So we passed on both bills, allied and healthcare professional bills. So the NCHP Act is common council, sir. Allied health is a separate category, healthcare is a separate category. Everything on our NCHP Act law. Our people are telling wrong information. Sir, actually I am telling a lawful definition, sir. As per NCHP Act, section 2D, allied health sciences including technicians and technologists. Again I said, sir, as per NCHP Act, section 2D, D for doctor. As per NCHP Act, section 2D, including allied health sciences. Allied health sciences means paramedical technicians and technologists. For example, lab technician, 2 years people are technicians. If they are studied 4 and a half year now, they are considered as a technologist. But our NCHP Act mentioned, sir, as per NCHP Act, section 2J, healthcare professional means therapist and scientist. Our NCHP Act, unfortunately, they are not mentioned who is scientist. But therapist means physiotherapist, occupational therapist only, healthcare professional. I had a rights to information act, sir. I am having variety states, sir. Every document from every state, central government, sir. This is, I had a full format, full file, sir. So our central government clearly said, sir, physiotherapy not a allied health sciences. It is healthcare professional. Then some people said physiotherapist not a technologist because of, sir, allied health sciences including technician and technologist. Again I said, sir, as per NCHP Act section 2D, allied health sciences including technicians and technologists. They are only supported for diagnostics, treatments like that, sir. That purpose only. But as per NCHP Act section 2G, therapist role is can diagnose, can treat any disease. Actually, sir, our NCHP Act, physiotherapist definition says you can do any diagnosis, you can treat any disease. They said, sir, physiotherapy means who practices physiotherapy. Actually, sir, our NCHP Act physiotherapy definition is the physiotherapy professional who practices physiotherapy by undertaking comprehensive examination, appropriate investigation, advise and provide treatment to any person. Advise and provide treatment to any person means we can treat any disease, sir. So, but sir, one limit is we cannot try to prescribe allopathy drugs. Physiotherapy is the drugless therapy. We can treat our manipulation, mobilization. They are given, sir. UG holder also, we can do any manipulation, mobilization.
About clinical practice that the NCHP has described, you are telling.
But sir, yeah, sir, NCHP Act only lawful definition. Yeah, our every clinical practice, not only clinical practice, academic practice also, everything based on the NCHP Act.
Although doctor prefix is not mentioned,
Yes.
but the independent practice is mentioned.
Prefix DR, they are not mentioned, sir, because of every council not mentioned prefix DR matter about. But
Any
our
guidelines or any recommendations for the salary pay scale as per qualification or experience in the clinical practice, sir?
it will not. Actually, sir, commission cannot recommend salary, sir. Directly cannot, but commission will change the professional cadre. Lots of people don't know, sir. Commission, salary. Actually, sir, I want to say something. Tamil Nadu state government consider a physiotherapist as grade 1 and grade 2 technicians. So lots of cadre is there. So now, as per NCHP Act, we are healthcare professional. So our salary, MBBS healthcare professional, dentist healthcare professional, OIS healthcare professional, then we can claim a healthcare professional salary. When the cadre was changed, then only we will get our salary, sir. Actually, healthcare professional means it's a grade A, sir. Grade A. Actually, group A sector like that. Then, sir, it's equal to civil surgeon cadre also. Civil surgeon cadre means in government sector, MBBS with 10 years experience, they are getting civil surgeon cadre and they are getting more salary. So, government physiotherapy is fighting for that, but they didn't get because of the cadre. Government described grade 1, grade 2 technicians. Once the council came now, that will describe the professional cadre, sir. Actually, salary fixed by professional cadre, sir. Salary fixed
Okay.
by professional cadre, but our NCH Act directly changed our professional cadre. So automatically we will get good salary, sir. If governments actually, sir, by the NCH Act, government servant only they are getting more benefit. Government physiotherapist they are filed a case against that particular department, sir, because of we didn't get salary. We are also healthcare professional. By law they can file. Definitely they will win because of before that we are not getting any national level law. Physiotherapists we are telling themselves we are healthcare professional, but we didn't get any law, national level law. But now, as per national law, we are healthcare professional, like MBBS, BDS, OIS professional. So our cadre was changed. It's a lawful definition. It's a law. So as per law, hereafter we can file case against any state government. If once
Okay.
the judgment came out, definitely our salary will be increased, sir. Private sector also, sir. Because of hospital sectors, the orthopedic surgeons or administrators, they are conveyed to the chairman. They are all technicians. Don't give this kind of salary. Don't give this much of salary. 10,000 is enough. 8,000 is enough like that. But when we are getting recognition, even we can submit our NCHP Act document to private hospitals also we can give to HR and we have to convey to our hospital chairmen.
No, but
We are healthcare
more
professionals.
curious, I am more curious to ask, like, if
Mm.
institution is not following, they are not giving the proper salary, will
Mm.
the NCHP Act document be legally binding that we can file a case against the employer, or whether the institution will face any legal action from the NCHP?
Sir, actually, NCHP Act, it is used for government documents. For private hospital, we cannot do anything because of their actually their decision, management decision only. Even dentists also having council. Even dentists also in our Madurai district, 8,000, 10,000, 12,000 dentists also getting low salary. They are having council. Council it will not interfere the salary matter, sir. Private sector, we council cannot tender to the private hospitals. But as per NCH AP document, we can file the case on government sector. If I am a government employee, I didn't get healthcare professionals cadre now, we can file case against concerned.
I think that role is formed or done by the IMA, that anytime medical doctors are facing any issues, immediately the IMA actually takes the legal notice and then action immediately. Same way the dental association also, or the nursing, when you see that they go for a mass strike, okay, all over India.
We
If
are not
the
having unity. One thing I want
yes
to say
sir,
something. IMA, they are having more unity, sir. They are having more unity. If any issues now, all are joining together. All are joining together and voting for their rights, sir. But our professional, lots of association people are making. They are each and every tunnel, each and every lane, each and every tunnel people are making association and each and everybody is spreading false information. So we are not having unity, sir. That's why the crap story, sir. Crap story. If anyone going forward now, another people doing a lead pulling activities. That's why still now we are not developed that, sir. IMA, they are strong association. They are having more unity.
yeah,
For
because
example, sir,
being a World Physiotherapy member also and largest association in the country,
yes, sir. Largest association in our
so we
country.
should,
AP is getting.
we should work for making the association stronger.
Yes, sir. If I am a national president, definitely I will make stronger, sir. Because of I want to do only professional activities, sir. Because of I hate conference also, sir. Always making conference, no, it's not a good. We are doing some agitations. We are fighting for actually, sir. In the social side, social media, in public side, always we want to cry for our rights. Then only people will know, oh, physiotherapy is like that. Politicians also will know, okay, peoples are there. If you are not doing any kind of activities, no one will bother you about our rights. Actually, sir, when the child will cry, then only that child will get milk feed. If we are not crying, now we didn't get our rights. That's the true thing, sir.
Correct only. And in the NCHP, I wanted to ask, like, take us through the content of NCHP. Of course, you mentioned some of the things before, like definition, the autonomy, and you saw that how it is a legally binding document for the government institutions. But I want to listen like for clinical practice, what does the NCHP tell? And how is the Clinical Establishment Act, will it be abolished? Or like for example, um, independent practitioner, how they will be governed by the NCHP? As you told that working in government hospital, yes, fine. But private hospital, the private hospital has its own policies and rules. You can just communicate about the NCHP document, but they may not do anything, then you
So
cannot do anything.
for salary only we cannot do anything, sir. But dignity wise, no one cannot defend. We are the separate independent practitioner. NCHP had mentioned can do any diagnosis, can treat any disease. So independent practitioner. If we are not getting salary now, at least we will save our rights. We will save our dignity. In the lots of private hospitals, sir, lots of private hospitals, some orthopedic surgeons also, they are handling physiotherapists as slaves. I saw, sir, without fear. Actually, I am a straightforward person, sir. I want to say something. Lot of people, they are treated as slaves. So it's not good, sir. Once we are getting legal recognition, at least we fight for our independent rights. In the private hospital, lot of problems are. Actually, they are not seen orthopedic surgeon. They are not seen indication, contraindication. If that contraindication, now they are recommended for physiotherapy treatment. If indication, they are doing a contraindication. So lots of problem we had, sir. Once the NCHP Act, man, at least our independent rights will save, sir. For private practitioner also, they are having. They are also protected by NCHP Act. Sir, you said, sir, Clinical Establishment Act in the year of 2018, they are made one definition, sir. That definition against of physiotherapist independent clinical practice. Actually, sir, council only regularize the profession. Clinical Establishment Act regulates the clinic size. You are having a stethoscope. You should have thermometer. You should have IFT ultrasound. Like that only. Clinical Establishment Act regulate the clinics, hospitals only. Private Clinical Establishment Act cannot regulate a professional. But 2018 we didn't get any national level council. So purposefully the orthopedists and physiatrists, they are in that committee. They are made confused definitions, sir. Physiotherapist allied healthcare, allied health paramedicals. Healthcare means separate category. They are combined physiotherapist or allied healthcare professional like that. Physiotherapist cannot practice independently. Physiotherapist worked under any physician or general surgeon. Like that, the CEA, Clinical Establishment Act definition, sir, that definition is a just draft only. They are not implement on Clinical Establishment Act. For draft, they are keeping that draft and they are threatening a physiotherapist, sir. Actually, the Director of Rural Health and Medical Services people, they came to inspection because of our people don't know, sir. Clinical practitioner, they don't know about law. They show the documents. Physiotherapist, not an independent practitioner. Which doctor came to your clinic? So you cannot use the name of clinic also. You can use center like that. Lots of people harassing, sir. In Tamil Nadu also happened. I sent
Yeah, lots of
NCHP.
they have changed the nomenclature also.
Yes, sir. But sir, I sent NCHP to DM orchestras. After that, all are shut up their mouth. I send. We are the independent practitioner. So Clinical Establishment Act, we cannot register because of Clinical Establishment Act had a error definition. When you will change that time, we will register to the CEA. We are not opposing a CEA, but the CEA had error definition. Then confused definition also, sir. They are merged with allied health and healthcare. Physiotherapy means allied healthcare. Actually, as per NCHP Act 2021, NCHP Act is enacted. Then NCHP Act committee members also selected, sir. So the interim commission, sir, our council national level interim commission chairperson is Miss Akali Jumomi. Akali Jumomi, she is the additional secretary of Health and Family Welfare Department of India. Ekali Zumomi is also our council was formed, our office persons also selected. So we didn't get any fear, sir. I sent document to Tamil Nadu DM Orgachas, Director of Medical and Rural Health Services. Then they stopped the visiting of the physiotherapy clinics. So NCHP Act saved the independent products, both government sector, private sector, sir. But salary wise, commission cannot recommend, sir. Directly it cannot recommend, but it will change the professional cadre. Then only we will fight for our rights, sir. Actually, association.
But what I noticed, na sir, I noticed that in academic, there is a lot of importance is given. The
Yes, sir.
NCHP document, it tells about even who's a lecturer, who's an assistant professor, who's associate professor, what should
Sir,
be the pay scale.
not only for that, sir, they are given more criteria for physiotherapy college opening. Minimum 10 acres need, 10 acres need for new physiotherapy college opening. Minimum 10 acre, then the minimum square feet is 30,000 square feet for physiotherapy college, new college opening, sir. Then it is not applicable for tie-up with medical colleges. For example, PSG, government medical colleges. If government medical college having physiotherapy colleges, that's no need, sir. Because of already medical college had more square feet, sir. But new opening physiotherapy colleges, 10 acres should be must. So lots of physiotherapy college will be closed on our India.
Even
Because of, sir,
the seats also there are controversy.
sir,
The max.
actually, sir, I am very disappointed, sir. Actually, our NCHP had curriculum handbook made by our members, our physiotherapists. But they are mentioned minimum intake of MPT seats per institution, just 21 seats only they are getting. Sir, minimum intake of MPT seat is 21. What, sir?
Minimum or maximum, sir?
Oh, sorry, maximum. Maximum 21 seats per institution, but they are not mentioned anything about UG, sir. Because of in our Tamil Nadu, lots of colleges, sir. Excel College of Physiotherapy, Chennai AVS College of Physiotherapy, under deemed,
Medical Education and Research.
sir, they
MTR
had
Institute of
the
Education and Research, the deemed
MGR
university.
University, private mother, actually, sir,
Otherwise,
deemed MGR University, they are having 750 BPT seats per academic year. What is this, sir? So they are spoiled a physiotherapy professional. Then the Excel College, they are having 400 BPT seats per
you
academic
get
year.
an insider news, sir, whether that institute which is doing 750 seats, is it approved by the IAP? Is it a member of IAP?
No, sir. IAP can't do anything, sir. That is, they are getting approval from university, MGR University. We are not having council. We are not having any recognition. So their people, sir, university also spoiled our life. University, they all are in allopathy doctors. They are given approval. Actually, the private IAP is the private body only, sir. They cannot control it. IAP cannot control private colleges, sir. They are given some recognition, but they cannot control their seats because of once the government law made.
For
Sir, even medical college.
example, what we expect is we have listed the number of colleges, the colleges which are members of the IAP, recognized by the IAP for B.P.T and M.P.T. So these kind of malpractice colleges, are they still be listed or they should be blacklisted?
Yeah, sir. Sir, actually something happening on that depends upon the president. If I am on president now, definitely I will cancel lots of colleges recognition. But sir, private college they don't need IAP recognition. It's not a mandatory.
No, but
IAP recognition is not.
professional awareness, all of us to know who is genuine, who is better, who is not. There has to be blacklisting of the institutions which are doing the malpractice.
Yes, sir. Malpractice happen in each and everywhere.
And
Each and everywhere. Lots of.
especially the courses like 6 months certificate courses in physiotherapy or 1 year program in physiotherapy. So lot of
Rajasthan, Madhav,
by National Skill Development Corporation under Government of India itself.
BSS, Bharat Seva
So
Sansthan.
although NCHP defined that it is a 4 years and plus 1, okay, 5 years, the proposed draft, okay, for the BPT curriculum. What about the diploma holders who are already existing? What did the NCHP state about the DPT or the diploma holders? Yes, sir.
Sir, this is good. This is good question, sir. Actually, our diploma banned on 1984. There is actually some people are having diploma that is illegal. Physiotherapy professional not having any kind of diploma course because of recognized universities. They are running the bachelor of physiotherapy only. They are not running recognized even MGR University, Rajiv Gandhi University. They are not running a diploma courses because of all over the India banned. But some we are not having council. That's why some institutions they are running diploma physiotherapists. It's not illegal, sir. So that's why our NCHP Act mentioned bachelor of vocational physiotherapy also illegal, sir. So we are not having national level council, sir. Actually, council even sir, Medical Council of India, they are pure government body. They are controlling a diploma courses. They are controlling a lot of professional issues. Sir, central government made a BRMS, Bachelor of Rural Medicine and Surgery. That course duration is 3.5 years. The doctors only worked on rural side. IMA strongly opposed that and removed that BRMS courses. Because of IMA, not only IMA, the IMA given pressure to the MCI, Medical Council of India. Then Medical Council of India taken a good decision. But we are not having council. That's why private association cannot control these things. State council also cannot control these things. When we are getting national level council, national level law, why we want council? Council made here rules and regulations, sir. A physiotherapist means who? Who is physiotherapist? How is his duty? How can he is the professional limit like that? So they are fixing physiotherapy colleges limit and the physiotherapy course limit. Now, sir, our NCHP Act definition schedule, sir. As per NCHP Act schedule section 2 on. Section, I am telling about law, sir. Section 2 are mentioned. Physiotherapy professional minimum qualification is baccalaureate degree. Again, I want to say something, sir. It's not a word. As per NCHP Act, schedule section 2
Does that
or
mean that diploma holders are not included in the NCHP?
they cannot enroll in NCHP Act. Diploma certified minimum qualification is only Bachelor of Physiotherapy. I got RTI reply from central government as well as lots of state government also. DPT peoples cannot enroll this council. Even old DPT peoples also cannot enroll, sir, because of they all are retired peoples.
And even the DPTs which were provided by the state medical faculty,
No, sir.
like
Central, sir, actually. What, sir? What, sir?
Uttar Pradesh,
State?
West Bengal, the state medical faculty approved institution, they provided DPT, diploma.
Yes, sir. State government providing diploma, sir. West Bengal state government given certified physiotherapy courses and diploma physiotherapy courses, sir. I know, sir. After NCHP Act, everything abolished. Actually, one physiotherapist given good Abhilas Prabhuraj from Kerala. He said Bachelor of Vocational. Yes, sir. This is also big trouble of us. Bachelor of Vocational Physiotherapy courses. Actually, sir, our professors filed by lot of factors.
And also, what will happen,
sir,
to the Rehabilitation Council of India?
Sir, Government of India.
The Rehabilitation Council of India.
Sir, actually, we are not under Rehabilitation Council of India, sir. Only speech therapist only registered the Rehabilitation Council of India. Sir, actually, physiotherapy not. Sir?
Medical lab technology, the radiology, nuclear medicine technology, the perfusion technologies.
What happened, sir? You are not visible now.
Respiratory therapy. I'm not visible.
What happened, sir? You are not visible.
I'm not visible, huh?
Yeah, sir.
Just a moment.
Now I hear your words, sir. Now I hear your words, sir. Actually, the West Bengal state government, sir, once national act framed by central government, now automatically this NCHP Act overriding against a state government, sir. Then the every things will be changed by our central NCHP Act.
No, my question is, what will happen to the MCA and the Dental Council? They will continue to exist. They will be existing.
Yes, sir. Actually, sir,
they will
dental council,
National Medical Commission.
Now the dental council also going to abolish, sir. The dental commission already made, sir. Made by central government, NDC.
National Medical Commission. National Dental Commission.
Yes, sir. Then Medical Council of India also abolished, now named as NMC, National Medical Commission.
So, and Ayush will stay as separate, as a ministry separate.
What, sir?
Ayush. Ayurveda, Yoga, Unani, Siddha, Homeopathy.
Sir, that's also Indian Commission processed by Indian Medicine Commission also processed by central government, sir. Indian Medicine Commission.
Okay. Okay, traditional medicine.
What, sir?
No, because there are courses in Rehabilitation Council of India. I have seen courses. In that, there is like yoga, naturopathy, physiotherapy, and naturopathy.
Oh, RCA approved, eh?
RCA approved courses are there.
Oh. Sir, that should be everything stopped by our Central NCHP Act, sir.
No, because Rehabilitation Council of India, unless it is scrapped, because this occupational therapy or even the speech therapy or the medical lab technology, occupational therapists came out. Seeing physiotherapists came out of RCI. Occupational therapists also came out. But speech therapists are still in RCI, as you told. And speech therapists are under NCHP.
Sir, then psychologists also in RCI, sir. Psychologists also.
Psychology, clinical psychology, all are in RCI.
Sir. Clinical psychologists on RCA.
Overlap. And diploma holders in medical lab technology, diploma holders in speech, or diploma in radiation technology, radiology and nuclear medicine technology, they are all there in NCHP.
Yes, sir. They are under
diploma holder also. Both are registered in NCHP.
Yes, sir.
In physiotherapy, diploma not included like that. Any statement is there?
Yes, sir. For physiotherapy professional, they are not including any diploma courses.
I told minimum qualification is baccalaureate degree. But
yes, sir. Minimum qualification is baccalaureate degree only, sir.
Diploma holders will not be eligible to register. Like that, any sentence is there in the NCHP for physiotherapy.
What, sir?
I think you are busy. You are getting something in between.
Sir, now I can hear, sir. Please tell me, sir.
No, I am asking. Other courses, diploma holders are also included in the registration for NCHP.
Yeah, sir.
Physiotherapy, they have put minimum qualification is bachelorate degree.
Yes, sir.
But did they mention in NCHP that diploma holders in physiotherapy are not eligible to register?
Yes, sir. Diploma people cannot register because of clearly they are mentioned, sir. For physiotherapy professional, minimum qualification is bachelor degree only.
No, that is bachelor degree is mentioned, but during the registration eligibility, they have just mentioned 2,000 hours of education.
Sir, what are all the eligibility mentioned on schedule? That person only can register the registration, sir. That people only getting
a diploma certificate gives that it is 2,000 hours of education training.
Yes, sir.
That means that person becomes eligible.
Yes, sir.
Because NCSP mentions only 2,000 hours of training.
Sir, I want to say something, sir. For another professionals, optometrists, they are not mentioned about diploma courses. Because of they are having diploma, they are not mentioned minimum qualification. They are mentioned for physiotherapy, occupational therapy only, sir. They are mentioned here, physiotherapy, occupational therapy, they are mentioned minimum qualification. So the minimum qualification people only can register this council, sir.
They have not mentioned that physiotherapy assistant or anything like that.
No. If they are not mentioned, no, they cannot register, sir.
So
if they are mentioned,
where the diploma holders will register?
Sir, actually, what, sir?
Because diploma holders are directly having state medical faculty. They
sir.
They are registering under the state medical faculty. They are practicing also.
Sir, actually, after NCHP Act, everything will be banned, sir. Hereafter, the West Bengal state government will stop the diploma courses because of Central Council took legal action against of state. So automatically, state government follow the central government rules, sir. If Central NCHP Act, national chairperson sending instruction to state, each and every state should follow that. Because of best example is NEET exam, sir. NEET exam is the national law. No one state cannot reject that. And the same thing NCHP Act also, sir. That is a Indian constitution. Each and every state must to follow that, sir.
No, NEET exam also, it's only in the proposal stage. It's not come in the what is called as the establishment or the implementation stage.
No, sir. Even curriculum handbook also, they are not mentioned anything about diploma holders, sir. Curriculum handbook also, they are not mentioned anything about diploma.
I am more concerned because they don't mention anything. So we cannot
Yes, sir.
assume anything. In any direction, we cannot assume.
No, sir, nothing. Sir, in the registration committee, our physiotherapist only decided that other professionals cannot decide that, sir. Our physiotherapy professional, actually, for example, the curriculum committee nominated a physiotherapist, sir. The physiotherapy curriculum may actually the draft made by our physiotherapist only.
Yeah,
Other
yeah. There's a group of
our,
physiotherapists
for
from across
registration
India.
also, our people only appointed, sir. For registration process also, our people only appointed by central government. So
No,
our
what I am
people,
trying to see is what will be the
uh,
action recommended by the committee for this kind of a 2 years program, 1 year program, 6 months program. All these people, the courses, how it will be stopped unless it is listed as a malpractice by the
sir,
NCHP.
actually, central law clearly mentions there that minimum degree is the B.P.T only. So that's enough, sir. So that by document, each and every state automatically stopped.
No, nobody has. Very few people would have stopped, but now also it's all continuing everywhere.
Sir, actually, because of our NCHP Act not functioned, sir. That's why people are getting these kind of doubts. Once the commission was started, I hope, sir, our Dr. Yagna Sugla from Gujarat, she was a physiotherapist. She entered into our NCHP Act chairperson, sir. This month she will join. She will catch her Delhi officer. Then only these every changes will happen, sir. Because of she is a national chairperson.
Okay.
Yeah,
We hope
she is
that
a national chairperson. Sir,
we
hereafter
hope that there
also,
will be changes
before
that will be
registration,
implemented, and we
what,
need
sir?
to track it. We have to track the progress, what is happening in the further documents published by the government of India. And
Then again,
any
sir, again I want to say, uh,
like clinical practice and academics, is there
mm,
anything told about research?
what, sir? Clinical practice?
Like clinical practice and academics were explained by the NCHP about research.
Oh,
It mentioned,
research mentioned,
yeah.
sir, yeah, sir, because of that is, sir, above 500 pages, sir. There's a lot of provisionals made by our curriculum committee.
No, curriculum committee is academic. For research, what
Okay.
are they mentioned in the NCHP? What are the
Sir,
recommendations
actually,
and what are the guidelines?
sir, here a lot of guidelines hereafter only made, sir, made by central
I am
government.
telling,
Even,
there are a lot of missing gaps in the NCHP. At this level,
sir,
we
actually,
see
now
that
the
the
gazette
verdict
only released.
also,
Now the gazette only released, sir. When the registration will be start, that time again some rules will be made by central government, sir. Regarding even, sir, we will get prefix DR in front of their name also. When the committee will be formed, that time we will get prefix DR also, sir. I hope.
and can you highlight all
People,
our viewers on how many states have formed the state councils as per the NCHP Act, sir?
sir, 15 state government
In,
formed, sir. 15 state
in
government formed.
chronology, first one where it was formed, and now the latest last what is formed, like in that
Sir,
sequence.
first state is UP, sir. Uttar Pradesh State Allied and Healthcare Professional Council only formed. Then, sir, the latest days we know the Tamil Nadu state, sir. Tamil Nadu state government, they
After
are
UP,
also
what
released their
was
gazette.
formed?
What, sir?
After UP.
Before Tamil Nadu,
Yeah, all the 15 you tell in sequence. Like
okay, sir. Okay, sir. Sir, Kerala, 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 Andhra Pradesh, Kerala,
okay.
Andhra Pradesh, West Bengal,
After UP, Kerala, then after Kerala is Andhra Pradesh.
Andhra Pradesh, West Bengal,
Okay, then West Bengal.
Telangana,
Okay, Telangana.
Telangana, then hello.
Sir.
Sir, Arunachal Pradesh.
Okay, 6.
Arunachal Pradesh. Then Mizoram.
Okay, 7.
Mizoram. Then Mizoram. Arunachal Pradesh. South side. Telangana. Kerala. Then Mizoram, I said. Nagaland. Sir,
Nagaland, okay.
Tripura.
Yes, sir.
Tripura, sir.
Tripura 9.
Tripura 9. Then Odisha.
Okay, what is that 10?
Odisha. Then Odisha state government. Then Himachal Pradesh.
Okay, 11.
Himachal Pradesh. Then UP, I said. Remaining 4 or 5 state missed, sir.
Jharkhand.
Jharkhand, no, sir. They are not constituted.
Then the Jharkhand State
Jharkhand
Physiotherapy
State-
Council headed by Dr. Ajit Kumar is not as
Sir,
per
that is the one council, sir. Sir, Jharkhand state have a own state council. Now I said about as per NCHP Act, the State Allied and Healthcare Professional Council.
So that council is not as per the NCHP.
What, sir? Sir, actually, once NCHP Act formed, now automatically every state council will be dissolved, sir. Hereafter, Jharkhand Council also going to dissolve. The new council named as Jharkhand State Allied and Healthcare Professional Council, sir.
Okay.
Sir, even Maharashtra Council, they are stopped the state council election due to the processing of the Maharashtra State Allied and Healthcare Professional Council as per NCHP Act, sir.
And what about Delhi or any other Uttarakhand?
Yeah, I had RTI, sir. I had RTI reply. Delhi state government given reply to me. Delhi State Allied and Healthcare Professional Council is under process.
Okay.
Delhi, lots of states, sir. Madhya Pradesh, lots of state government given. Because of, sir, I send Rights to Information Act application to all the state of India regarding to formation of State Allied and Healthcare Professional Council, sir. 28 states, I send 28 states and 7 union territories, sir.
Okay.
Then, sir, my effort only this 15 state government formed, sir.
No, it's not. They just gave a reply that it is under formation.
Sir, because of, I am given, I raised a question in legal way, sir. I raised and my question, it will stimulate to form the state council. Because if I am not sending RTA apply, definitely no one, government should not take necessary action, sir. Because of when I send RTA apply to Arunachal Pradesh, then only Arunachal Pradesh, even Arunachal State Physiotherapist also, then only our about NCHP Act and Arunachal State Allied and Healthcare Professional Council. Then Kerala State Government, then the Tamil Nadu Government, even rejected my RTA application, sir. They are rejected 3 times. Again, I am submitted to the Odisha state government. Then only they are formed. They are sending reply letter to me. Then only I announced on public forum, Facebooks and Instagrams, the council was formed. Then only the state concerned physiotherapist knowing that, sir.
Okay.
RTA is the weapon, sir. RTA also is a big weapon.
Yeah, because the reply for the RTI will always come. But whether
No, sir.
in
Sir,
reality the concrete action is happening or not.
Sir, actually, every state government not replied, sir. Lots of state government rejected. Lots of state government, they are received RTA form. They are not replied still now.
Exactly.
Best example, Pondicherry state government. The Chhattisgarh state government, always they are rejecting my RTA application, sir. Chhattisgarh state government. Lot of state government doing like that, sir. If they want to form now, they will form, sir. If they don't want to form now, they cannot form.
Because Chhattisgarh like states, they already have that individual physiotherapy council, which is not as per the NCHP.
Sir, but Delhi council also having, Delhi state also having council, but as per law, every state council is going to abolish, sir. Even Gujarat state council also, now it is not functioned. Because of Gujarat State Allied and Healthcare Professional Council is under process. They are making committees, sir.
No, but even now, I wanted to ask you about this. In Gujarat, the workshops are approved by the Gujarat State Physiotherapy Council.
Yeah, sir.
That is the only place where we see that workshops are approved by the council. Okay.
Sir, again one a great plus point for us, sir. Our Gujarat State Council President selected us NCHP Act chairperson. So, what are all the good provision in Gujarat State? Everything it will be ordered to NCHP Act.
No, if you, as you said that Gujarat State Council has stopped existing, then how?
No, sir. Actually, sir.
That are being announced even this week, they are telling that it is approved by the Gujarat State Physiotherapy Council.
Sir, I am saying if Gujarat State President only become NCHP Act chairperson. So, what are all the good provision in Gujarat Council? Everything it will be ordered on Central Council, sir.
No, but Gujarat Council is. In fact, we saw that Maharashtra Council did a lot of good things.
Yeah, Gujarat State Council having a lot of good things, sir. Even they are putting prefix DR and suffix PT also.
Yeah,
sir?
That is there in both Gujarat and also in
Sir,
Maharashtra.
I think that province are also included in NCHP Act. Physiotherapist can put prefix DR and suffix PT like that. Before registration, they are made some rules and regulations, sir. Sir, actually, before registration, the registrar appointed by NCHP Act chairperson.
Okay. That is the state NCHP. State councils as per the NCHP Act you are telling.
No, sir. It's a national law. Sir, actually registration is two registration available, sir. One is state registration, central registration. So every state people, if they don't want to register state, directly they can register central.
Okay.
Two registration available, sir. State and central. Actually, physiotherapist.
Is, there are drawbacks of all the state associations. The state council.
Sir,
pardon me.
Sir, actually, one law. Sir, every rules made by Central NCHP Act, sir. Actually, now the state government toothless. They are toothless and powerless, sir. Every notification came from Central NCHP Act. So that only followed by.
I actually anticipate that the state council they will resist the formation of the NCHP Act based councils. The existing existing state councils they will resist the formation of the NCHP based state councils.
Okay.
Because they are already functioning.
No, sir. No, sir. Actually, NCHP Act
non-democratically functioning.
NCHP Act, State Allied and every healthcare professional council is not function, sir. Just they are given notification, people's members are silent.
No, I agree that many of our physios don't even know, they have not even read the NCHP Act, what is published for physiotherapy. Okay, I agree that.
Sir, but everything positive for us, sir. Because of we want registration, so the registration is coming soon. Our Yagna Sukla selected as NCHP Act chairperson, so everything positive for us, sir. Before registration, they are made some rules and regulations, sir. If a registrar allowed, physiotherapist can use prefix DR, that's the rules. Then, sir, I want to say another true thing, sir. Sir, when we are registered in NCHP Act, then only we will reveal lakhs level physiotherapists living in our country. So then only we will reveal our strength. Then only we will get separate commission, physiotherapy commission like NMC dental. Then only we will get and we will move from this NCHP Act, sir.
Okay.
When the registration will start.
Long-term developments you are trying to see. Okay.
No, sir. Within 3 years, we will outcome from this NCHP Act. But the registration should be must. When we will register, then only government will know. Okay, lakhs level physiotherapists are living, so they need separate commission like that.
Okay.
Because of our physiotherapist selected as chairperson, if they will recommend, government will approve. Otherwise, by single person, single group of association, we cannot do anything. Once we are enter into the government sector, then only everything will be happen, sir. Especially,
and also,
Prime Minister.
I wanted to find out if NCHP has mentioned anywhere that as per the recommendation of IAP, anything they have mentioned?
No, sir. They never mentioned any association. They never mentioned anything.
Because if you see NMC, they mention the IMA.
Oh,
Okay. That is why
oh.
when in our discussion also we were telling that we should work for strengthening our IAP.
Yes, sir. Yes, sir. Sir, I love IAP. We want to strengthen. I hope when the election will come, that time good president will be selected, elected. Then everything it will be good, sir.
Okay. So are you communicating all these developments to the IAP routinely?
Each and everyone watch my activities, sir. But I can't say anything. I never say anything. Each and every people's watching me. They knows about these developments. But what I say, sir. Actually, sir, generally I am telling, real good hard work peoples didn't get any recognition. If people didn't do anything, now that people is getting more recognition, sir. But anyway, sir, I left all the state of physiotherapist heart. Every state of physiotherapist knows about my hard work, reality, and professional dedication. So definitely, that's why I am very happy, sir. Not association side, but public side, I am getting more recognition, sir.
Yeah. And what are your closing messages? What, as for a student, now if a budding physio is there or a studying student is there in a college, practicing
Okay, sir.
clinician, yes, fine. Teaching physio, plus fine. If it is PhD, any guidelines for PhD is also given?
In NCHP Acta.
Yes, sir.
Sir, actually, they are in 500 pages, sir. Lots of rules and regulations they are made. For curriculum side, I read something only, sir. Main things means I want to save the profession.
Because
First of
recently I
all,
have seen that some of the private universities are starting Doctor of Physiotherapy program.
sir, that's not good, sir. When the government side will be start, that only good, sir. If private institution, that's not legal, sir. Legally, it's not good, sir.
And you see that it is only 6 years.
It's not
So
good,
that
sir.
means
When,
5 years
sir,
is
actually,
B.P.T, 2 years is masters. Okay, 7 it comes. After masters, then 4 years PhD or 3 years PhD, 10 years is now replaced by Doctor of Physiotherapy, which is only 6 years.
mm. Sir, that's
And
all.
this is
Regarding that, I
introduced
sent mail.
by Srinivas University in Mangalore.
Sir, that regarding this matter, I am creating lot of awareness to public, our physiotherapist forums, and I will send mail to our NCHP Act secretary regarding kindly made DPT, the Doctor of Physiotherapy 6-year degree program. Please announce these courses also like that. If they are started this course now, we are very happy. But otherwise, the private institution, university DPT is totally waste, sir.
Yeah, because when it will look like it is a advanced diploma. Because
Yeah,
in our terminology in Government of India, DPT means Diploma in Physiotherapy.
yeah. Then, sir, that course also not standard, sir, standardized. When the government will start now, then only our profession will be standardized, sir. Because of USA government, they are having DPT courses. Even Pakistan government also approved the DPT courses, sir. Pakistan and lots of countries, sir, Canada, USA, Bangladesh, this kind of countries, they are started at Doctor of Physiotherapy courses. I hope India also it will coming soon, sir.
The last final 2 questions, you see that there are techniques like cupping, ISTM, dry needling, or shaping. These are all from alternative medicine. And
Yes, sir.
in many countries, different countries, they are using it under physiotherapy.
Yes, sir.
So in NCHP also they have included all this.
Yes, sir.
So what is your opinion on this?
Sir, actually, anyway, once added to our subject, now that's also our syllabus. But the true thing is, exercise therapy, massage therapy is very effective, sir. Actually, we are studying a lot of techniques, sir. The selection of the treatment techniques should be important. For my part, the cupping therapy, dialing is no need, sir. For my part, if once they are ordered to our syllabus, now that's also our subject. That's also depends upon the person, sir. If it depends upon the clinical therapy, somebody is always using electrotherapy. Somebody is me type of professionals. We have never used electrotherapies. Always using massage therapies and exercise therapy only. Manipulation, mobilization, PNF technique, NDT technique, like that, sir. So it depends upon the therapist, sir. Then,
Okay.
sir, for some patients,
The most interesting question is, we see that many physiotherapists are getting trained in osteopathy and chiropractic.
okay.
Are these professions listed under the NCHP?
No, sir. No, sir. Osteopathy, chiropractic not included in NCHP Act because of osteopathy is a separate 4.5-year degree program, sir. Osteopathy, chiropractic, it's a separate, separate.
Doctor of osteopathy is not in India.
What, sir?
Chiropractic also 4 years one is not in India.
4.5 years, sir. Yeah, not in India, sir. So we don't bother about osteopathy and chiropractic. Then, sir, our WCPT.
As per the government of India, osteopathy and chiropractic are not listed as healthcare profession only.
They are not listed healthcare professional, huh?
Yeah. Because in NCHP they are not defined osteopathy chiropractors.
Yeah, sir. Actually, that is irrelevant topic for us, sir. That is not our wish. Our motto.
No, but the maximum physios are doing osteopathy and chiropractic, sir.
Sir, actually waste, sir. Osteopathy.
They are telling that they are osteopath and physiotherapist. In their clinical,
sir,
they are using chiropractic.
People are confusing that, sir. Osteopathy, it is not a physiotherapy. Osteopathy is separate. But some technique similar with physiotherapy technique, sir.
Yeah.
Because of,
we have taken myofascial release and all, it is from osteopathy only.
Yeah, actually, sir, physiotherapy is the captain of the every profession. We can do any, actually, we are having every technique, sir.
No, my query goes like this. When they are not listed in the NCHP as a healthcare profession,
no need. Actually, basically, I want to say something, sir.
Using osteopathy and chiropractic, will it become illegal?
Actually, basically, I want to say something, sir. Already, our high velocity thrust technique, it is similar with osteopathy. So, osteopath, they are doing high velocity thrust technique only. So, already we are studied in our syllabus. Then, sir, osteopathy, we cannot do osteopath high velocity technique for all patients. Because of we are given grade 1, grade 2, leading to each and every person, sir. Even frozen shoulder patients, they cannot bear grade 5 high velocity techniques. Definitely, we will do grade 1, grade 2 techniques only, sir. So, our techniques only appreciated one. So, no need osteopath or chiropractic, sir.
No need is an individual opinion. What I am trying to tell
is,
what does the
sir, my opinion is
tell about osteopathy and chiropractic? If it is not mentioned anything, it means that it is not listed as a healthcare profession.
Yeah. Not listed as healthcare professional. Sir, my personal opinion also, first we want to save our physiotherapy profession, sir. If anybody want osteopath, they going to join 4.5-year course. They will get degree, they will leave physiotherapy, they will do their osteopath or chiropractic technique. Don't merge with another technique, sir. I want to say something, sir. If anyone studied, sir, if anyone studied a certificate course, sir, I raised one question, sir. If any individual person, they are getting certificate course or diploma course, they can do physiotherapy, we will allow. Or otherwise, MBBS professional, they are doing some certificate course, they are doing physiotherapy, they are also physiotherapists, we will allow. What is that, sir? Every reaction is the same. I want to say that one, sir. We are fighting for our rights. Osteopathy is a separate profession. Then the chiropractic also separate profession. So, however, our physiotherapists
are not listed under the NCHP also.
What, sir?
And those professions are not listed under the NCHP also, under Government of India.
Yes. Sir, actually, Clinical Establishment Act also not mentioned about maybe the chiropractic and the osteopathy manipulation.
They are not there.
Actually, sir, what I say, it's not good. If physiotherapist, we will do our work. What we are studying, we will apply for that only. If we are merged with another technique, definitely our professional future will be spoiled, sir. It's not good, sir.
No, it can be improvement also. It's a development.
No, sir. Already we have, sir. Cupping actually, my opinion is.
See, cupping is got integrated. So, if we mention osteopathy, chiropractic under physiotherapy means it will get integrated and physiotherapy will improve.
Sir, actually, already we are having chiropractic technique, sir. Our high velocity technique already we have. Then why need to study chiropractic
High
or
velocity technique
osteopathy?
is not the only technique, sir, in osteopathic chiropractic.
Okay.
There are a lot of techniques. What is
Yeah, they are
important
doing.
here is to recognize that professional margin or the boundaries.
Sir,
As
but I want to say
you
another
told,
true thing, sir. Physiotherapist level, they cannot sign, sir. Even osteopath, chiropractic, that professional, they cannot sign like physiotherapist. They cannot sign like us. Because of we are touching lots of patients, we are touching all the people. If patients are having stroke attack, now by osteopathy we cannot cure. By chiropractic we cannot cure. But we are touching neurosurgery, neurology, every patient, sir. So
yeah, can
our
you show your
physiotherapist.
full face, sir? Full face can you show?
Then our physiotherapist don't actually, sir. I want to say something. I want to become a good physiotherapist. Nowadays, our peoples they are forgetting our old technique. They are mentioned
Sir,
osteopath.
only your eyes are visible. Can you sit little far from the
What,
camera?
sir? What, sir?
Can you sit little bit behind from the camera?
Sorry,
Then
sir.
only your eyes are visible.
Oh, now, sir. Now,
Your full face is not visible.
sir, your face also not visible for me, sir.
No, I am visible at least half. I am visible.
No, sir. I am also visible for me, sir. I am also visible for me.
No, your
You,
face only eyes are visible. Eyes and nose. You have to sit little
I
bit
don't know.
behind from camera.
Little bit.
Away from the camera.
No, sir. Now I am on camera only, sir.
Now your lips are visible. But your face is
Oh.
not fully visible.
Now, sir.
Okay. So either way, we have taken almost 1 hour and 45 minutes,
Yeah, sir.
and we elaborated and we brainstormed on the major aspects of the National Commission for Allied and Healthcare Professions,
Okay, sir.
NCHP. We had our
Okay, sir.
privileged opportunity to listen to our guest, Dr. Tiger Diwagar sir,
Thank you so much, sir.
and we will again hold another session as subsequently the developments in the NCHP happens. At every stage, we'll follow it up and we'll also update all the professionals across country directly from Dr. Diwagar sir